Alexander, and I'm honored. Hi, I'm Dr. Carolyn Alexander. Hope you guys are having a good day. It's an honor to be with my wonderful partner, Dr. Hal Danzer. I don't know if you want to say a few things, Dr. Danzer, to start off.
Well, we're happy to be here together this afternoon. I hope you're inside where it's cool. And we have, I think, some good information about how to improve your chances of being pregnant for both the man and the woman.
Yeah. Next slide. I'm from LA. It's so nice to be here at Southern California Reproductive Center. Our lab, our embryology lab's been here since 1999, and I've been using our lab here since 2007. A lot of my research has been on polycystic ovary syndrome. It's a very important topic to me, and patients that have that and face that, I help them through the process, as well as recurrent pregnancy loss. And here with Dr. Danzer and all these great minds, we're constantly keeping on the cutting edge. And our team is constantly trying to improve our pregnancy rates and stay up to date with every single aspect from A to Z of what we can do. And we're going to talk a little bit about those topics today. Next slide. Dr. Danzer. You want to talk about yourself?
Everybody asks how frequently, how did you become interested in hormones and reproductive endocrinology? And I'm the grandson of a midwife in rural Montana. And I always want to compare myself to what we have today with an IVF laboratory and putting sperm and egg together and creating embryos. And what my grandmother had to work with as a midwife in rural Montana in the late 1800s, and how the world has changed and how much we should be grateful for all the technology that we have today.
Awesome. So in general, today we're going to talk a lot about all of us, and our group is very, we've been working together for a long time, and our sites, we have a site in Pasadena that's fantastic. And we used to have an office in Burbank, but now with telemedicine, we're doing a lot of video calls to get the initial information and talk things through with each patient individually and give individualized care. And we have a fantastic embryology team and lab in Santa Barbara. And some of us go there and do egg retrievals there for patients in that area. And that's been very lovely to help patients from all over California and all over the world. Next slide. Our facility here in Southern California Reproductive Center in Beverly Hills has a first floor. And since COVID, it's really helped patients get in and out quickly. And it's a lovely unit. Our front desk team is so warm and welcoming. Our lab team works very hard to get patients through the system to check your estrogen levels and all your hormone levels. We have an internal lab that gets those reports to us each day, and each doctor reviews them with their team to go over with the patient the plan. We work with sonographers, ultrasound techs that are extremely amazing and phenomenal, and they take detailed measurements, and we can actually watch the videos and watch the ultrasound images in detail as well. And next slide. In terms of our lab, the embryology lab's a big part of in vitro fertilization as well as intrauterine insemination. And we have an experienced embryology director. He's a PhD who has a lot of experience and keeps us on the cutting edge and gets the highest success that we can. We have a double witness system. So 2 people look before the embryo is thawed and transferred. And at the time that the eggs are frozen, 2 people are witnessing everything. We are one of the first centers on the West Coast to grow embryos for up to 7 days in the dish, which was phenomenal to be able to allow the embryo to develop over that time and watch them grow. And we've been freezing eggs and embryos with vitrifications, which is the best way to freeze eggs or embryos, and it's called flash freeze. In terms of checking an embryo for chromosome issues or specific genes such as sickle cell disease, cystic fibrosis, any specific gene that we're faced with, our team is able to do this with what's called pre-implantation genetic testing. And that has really been a phenomenal, amazing work for us so that we can avoid genetic problems in pregnancies and help our patients get a healthy baby. The EmbryoScope is an incubator that provides a lot of information about the embryo over those 7 days. It provides about 1,000 data points. And I think Dr. Danzer will talk a little bit further about that too. Next slide. So today our focus is talking about age factor, what we talk about in our patient discussion when we do our first history with you, ways to improve egg quality and sperm quality. How do we save your fertility for the future? So egg freezing or embryo freezing or sperm freezing. And fertility treatment options such as using donor sperm if you're a single woman ready to start a family, a same-sex couple, we can talk about donor sperm, donor eggs, surrogacy for patients who face health issues that they're not allowed to carry a pregnancy, or for any social issues can't carry a pregnancy, we can help you get a healthy surrogate. And we can talk a little bit about any questions at the end. Dr. Danzer and I can read through any questions in the chat and help us get through those. Next slide. So in terms of age matters. I started my family in my late 30s, early 40s, so I completely understand when patients are faced with age, issues and realize they want to have a child later in life. And so there's always a good egg, but we have to work hard to get that egg that's genetically strong to pop up. And especially when we're helping patients, our average age of patients coming here is near 40. So half our patients are younger and half are older. So we have a lot of experience, and Dr. Danzer has a lot of experience with patients who are older, and that gentle touch with those eggs is very important. It's always a little eye-opening to see the genetics and age, but as we hit 35, no matter who we are as women, our eggs start to change in terms of risk of Down syndrome, risk of chromosomal problems. And so it's just important to recognize that, and that it does take a whole group of eggs to get the golden egg that's there. And so I think that's good to talk about. In terms of statistics, each doctor can talk to you about your age-related chance of getting a normal embryo and how many eggs you might need for the future to get a chance for a pregnancy. Next slide. So in terms of your medical history, it's really important to talk about health issues like asthma, thyroid problems, low vitamin D, pre-diabetes, or some of our patients with polycystic ovary syndrome have acanthosis nigricans, or darkening of the skin in their underarms or in the thighs, and that's a reflection of insulin resistance. And so we dive in deep talking about a lot of health issues during our medical history review. We go into details about how much coffee, alcohol, any vaping or marijuana or CBD oil. So we talk about with both partners what we can do to optimize egg quality. We take a physical exam. So with that, we'll do an ultrasound as well as make sure your pap smear is up to date, your mammogram's up to date, that you've had your annual physical with your primary care doctor. And then we do important diagnostic tests that look at your egg supply, egg quality, the fallopian tubes if you're trying to conceive now, the uterine cavity, as well as the semen analysis, looking at all the parameters of the semen analysis. Next slide. It's very important to understand what is AMH, anti-Müllerian hormone. It's a blood test. It can be done any day, anytime. It can be done if you're on birth control pills. Basically, it's a blood test that's used in conjunction with your age, the ultrasound, and the blood test to see what your ovarian reserve or egg supply is. We've had many patients come in, having low AMH levels and crying and feeling very down, but we still can get them good eggs and good embryos. So it's just a number. We use it as a tool to discuss options. And AMH at any age, any time, we're hoping for it to be above 1, but the sweet spot is 2 to 8. When it's above 8, that's a red flag from the ovary that it's producing a lot of AMH, and that is a sign of possible polycystic ovary syndrome. It can also be a sign of congenital adrenal hyperplasia, which is a sister issue to PCOS. So it's important to talk about that with your doctor. When AMH is less than 1, we start to think to ourselves, why is that happening? Is there endocrine disruptors in your lifestyle? Is there autoimmune issues that we might catch, such as anti-ovarian antibodies? Could you, by chance, from your family lineage, carry fragile X pre-mutations, which is on your X chromosome, which can lead to changes in our fertility earlier than average age in women? Sometimes, if we're shorter than our mom, the X chromosome can have a missing piece, which can be a Turner's mosaicism, and that can cause AMH to drop really quickly at a young age as well. And a few other things is heavy smoking can damage and hurt our ovarian reserve, and as well as any exposure to medications, chemotherapy, radiation, things like that. The other hidden signal that we catch sometimes is hidden endometriosis. And endometriosis is when the inside lining of our period grows where it shouldn't grow. And that can cause microscopic inflammation that can disrupt the ovarian reserve. And so it's important to think things through methodically to see why your AMH might be a little lower than expected. And sometimes we have people do acupuncture, go gluten-free, start really amping up their exercise if they weren't exercising, and we see AMH kind of improve a little bit, even though the textbook answer is that it's very hard to fix an AMH issue. And again, we use it in conjunction with many other factors, so it's not a perfect test. Next slide. In terms of the male factor, it's important to look at the count of sperm, the volume, the motility, and the morphology. We get asked every single day, what is morphology? And this is a really beautiful picture, but this is a normal head, mid-piece, and tail. This is an enlarged head, a smaller sperm. This one is a pointed head, which is actually hard for it to get into the egg. And then with a double tail or double head, those ones are very hard because they cause chromosomal issues typically. And so since COVID as well, when people have a high fever, it might impact the sperm morphology for a month or two. So it's important to recognize that and take antioxidants, avoid artificial sweeteners, avoid hard alcohol. The other thing that affects sperm quality is heat, such as saunas and jacuzzis and long bike rides. But everyone loves the Peloton. I even have a stationary bike, the old-fashioned kind. I've never jumped on the Peloton bandwagon, and I love it, and my husband loves it. But the bike, you want to every once in a while get up so that it's not too much heat on the testicles. And it's important to talk about what medications men are on. I just had a patient that the man was on a lot of medicines that actually impact sperm quality. And so we had to have a talk about that and strategize how to get better quality sperm. Next slide. And ways to improve eggs and sperm quality, we'll talk about proper nutrition, Mediterranean diet. Dr. Danzer always echoes this to all of us, that it's really important to have lots of colorful fruits and vegetables and have a well-balanced diet. It's okay to have a free day here and there, Friday night, Saturday night, to have fun and go out and eat whatever you want. But the rest of the time, you want to be a little more cautious. The other thing with this intermittent fasting, which I don't know if you see this too, Dr. Danzer, but sometimes for men or women, sometimes there's a little bit of a shock to the system when you do this long intermittent fasting, and perhaps it affects your cortisol, which is your stress hormone. And maybe that might impact egg quality, sperm quality. So I always tell patients, we really want your hypothalamus and pituitary to sense lots of good nutrition. Why wouldn't I want to get pregnant? And so it wants to conceive and ovulate properly. When there's a sense of nutritional deprivation, the body might say, why should I try to get pregnant? There's kind of we're in a famine right now. So it's important to think about that. When I was trying to get pregnant, acupuncture saved me. I swear it helped me take time to really focus on myself and egg quality, and acupuncture really helps. I had a fibroid that was relatively big, and it really helped me to lower the bad cramps. Meditation, mindfulness, Dr. Danzer's a pro at this and can talk about it as well. But it's important to recognize that our body, from driving in LA and the hecticness of your work, you have to take time to take deep breaths and really recognize we are all on the same team trying to help you get a healthy baby and healthy eggs frozen and working together through the process. Next slide. In terms of nutrition, it's important to have higher vegetable protein. We love quinoa. We always are talking about it with the nurses. It has a lot of protein, especially for our vegan patients. Lower the carbs. So try to avoid rice, pasta, cookies, cakes. Amp up your vitamins. So each doctor has their favorites, but it's important to take a prenatal with the DHA or fish oil or plant-based fish oil and vitamin D as well as CoQ10. Lower the sugars because I would, in general, what sugar does is it spikes your insulin, especially in women with PCOS, and that's not ideal for egg quality. So it's important to try to limit unnecessary white carbohydrates and sugar. Vitamin D is really important. We try to keep it at 30 to 50, especially around the time of embryo transfer. It's important to take your folate and B vitamins, which is best absorbed with food versus vitamins, but it's important to take that as well. The omega fatty acids is really helpful in walnuts. There's a study from UCLA showing it helps sperm quality, as well as wild caught fish, because some of the farm raised fish might have micro chemicals in it that could be harmful for us in general, but everything in moderation. CoQ10 or ubiquinol is very helpful because it might improve the mitochondria, which is the energy source of your eggs. And so we encourage women to take CoQ10 as well, and as well as men. Next slide. In terms of exercise, remember blood flow to the ovaries is really valuable. That also, when you walk shots or stimulation for it brings blood circulation into the system so the medication gets there better. So we do encourage walking when you're on the injections. We don't really want you to do jogging or elliptical or heavy lifting because we don't want the ovary, which is a little top heavy, to flip on its blood supply, which doesn't happen, but it can happen. So we encourage not dramatic exercise and trying to focus on a healthy body weight. I always find it funny because for me to try to get to normal BMI is like impossible because my body won't do it. But I tell my patients, just do your best to get to a weight that you feel is healthy to be pregnant, because you don't want to start pregnancy already overweight, because that influences your knees and your body and your ergonomics, as well as the health of the baby and your risk for gestational diabetes. So it's important for both men and women, because there are really nice papers showing that men that are very obese, that may have ramifications for our kids too. So it's important for both of you to work together to stay as healthy as possible. Next slide. And to manage stress, so like I said, we work together with you to help you. I joke that you can leave a lot of the worry to us because we tend to worry, are those eggs growing? Is her estrogen optimized? What can we do to make the embryo transfer successful? So we're constantly thinking about that. And a thought came to mind when the slide about obesity and weight is sometimes we can have the embryos, and we have some patients that are pre-diabetic work really, really hard to get their hemoglobin A1C or their levels better, and then we put the embryo in, it has a much better chance to stick. So that is the beauty of IVF, is we can maximize your health before we put the embryo in as well, and lower stress. We work closely with therapists who are wonderful for both partners to help them air out their fears. I feel like when you talk it out, you break that vicious cycle of internalizing the fear. Next slide. In acupuncture, we have a lovely woman named Jennifer downstairs, as well as many people in the area who are fantastic. I tend to say go where it's near work, or where if you're coming in here, come in here, either way, so or home, so it's close by, not adding stress. But there is evidence that it improves blood flow, as well as, to me, it lowers cortisol, which is your stress hormone that bombards the egg quality and sperm quality. Next slide. In terms of what to avoid, I think since COVID, we hear a lot more about CBD oil, vaping, marijuana, I think people stayed home more, but there was more access to wine and things like that. So usually say around 2 to 3 glasses of wine a week while you're preparing your body. But during IVF or egg freezing, there's a 2-week window where we really, really don't want you to have any alcohol during that time if possible. In the prep time, while you're preparing your body for either egg freezing or IVF for embryo creation, we really want both partners to avoid cannabis if possible. It is hard to cold turkey. So we say, please cut it by half, and then a week later, cut it by half. You can talk to your doctor about it as well. With tobacco, in men, there isn't some evidence that if they can go less than 7 cigarettes a day, that would be best. But with women, it really does impact the blood flow to the ovaries a lot. And so we really, really want you to lower to none. And men, but sometimes it's harder with long-time tobacco users to get them to switch. There's Chantix or nicotine patches, and they can talk to their primary care doctor about that as well. Next slide. I'd like to pass on the baton to Dr. Danzer, and thank you so much for this opportunity.
Thank you, Carolyn. That was a lot of information to cover. And it's a reflection also of what we'll cover in terms of the best lifestyle for men in terms of improving their fertility. And then we'll go into some issues about IVF and how to freeze eggs and embryos and moving forward. But preparing for pregnancy is multifaceted. Again, it's whether you're a couple or a single person, getting prepared for pregnancy, but also getting prepared for the life after pregnancy, because then you're going to be a parent. And we know that parent health has a lot to do with the health of the offspring. And that has to do with diet and exercise, and just good health generally reflects on your kids. So getting started even before you get pregnant is an important thing to do. And so to improve sperm quality, maintain an ideal weight. But even before that, I always tell the partner, the woman partner, that tell your partner how lucky you are to be with them every single day. And get good energy goes a long way. And it's also a reflection of that you understand that there's a certain amount of stress involved in struggling to get pregnant if you've already been trying for a while, that you have to go together as a couple in terms of getting pregnant. So again, the ideal weight for both the woman, as Carol has outlined, and for the man, that's an issue too. There's just a recent study in the Fertility Journal this month about obesity in men and the issues about how that affects sperm quality. But it's also, here's your partner, your male partner, who's getting ready, hopefully, to be a father within the next year. And how do both of you work together to have a good diet and maintain the very best weight you can? Unfortunately, all you have to do is look online or on TV how we're bombarded by advertisements for food and alcohol. And, they're very good at selling their product, how to make it look good and make you feel good. But we all have to be very clear about what our goals are in terms of our health management and regarding to what we eat. And they talk about multivitamins and antioxidants, and I think that's a good thing. But also cooking your own food. Processed food is notorious for creating issues with inflammation. We don't know what's in processed food. There's a lot of things that are probably not healthy for us before you get pregnant or producing good sperm or even afterwards for our kids. So again, developing a lifestyle where you buy your own food as much as you can, which is hard today, but to try to prepare your own food and not rely on processed food every night of the week. Comes into reducing stress. To have to prepare your own meal is a little easier to call up and have them deliver something, but I think it's important. And it's not only important pre-pregnancy, but during pregnancy, but also developing good lifestyle choices for your kids. So. Then we talk about chronic medical problems, high blood pressure and diabetes. And a lot of times that's a reflection of weight issues. And I think we talk about, for many of our couples that come to us, is, to have a consultation with the nutritionist to look and see what calories you're getting, what foods. Everyone's unique. And what calories one person is getting in certain kinds of food is different than what might be beneficial for another. And my girlfriend, well, she's overweight and drinks a lot and she got pregnant easily, but that's not your body. Everyone is unique genetically, as we'll talk about later. And you have to create your own best practices in terms of good nutrition, good exercise, and stress management. And Carolyn talked about mindfulness, which I think is a great thing to do. And I think most people today are very aware of mindfulness. And stress is always going to be with us. Stress is never going to go away. Our jobs and life in the modern world, the stress will be there. It's how we manage it. And again, management of stress helps to decrease that adverse effect on your physiology. Stress has never been a good thing in terms of getting pregnant or maintaining one's health. All right, I think you've heard enough of that, but to move on, studies about boxers and loose underwear. Just reading an article, it was in GQ, that boxers are out now and other types of underwear are in. Cotton has always been stable. I think cotton breathes better than most of the synthetics. And there's a lot of synthetic products out there today that are being pushed, but I think cotton breathes better. And the reason for that, the reason the testicle is in the scrotum, that if you raise the temperature of the testicle 1 degree, all sperm production stops. And that's why the testicle is outside the body. So I think loose underwear is a good thing. Avoiding being a long time in jacuzzis. You have to be in the temperature very hot in a jacuzzi for a long period of time to be an issue. But again, if you're people that are sitting and working from home, you have to look at your chairs that the men are sitting in that breathe better. The meshes are probably better than leathers and other synthetic products. Go to the next slide. So we know that smoking is a vasoconstrictor, the nicotine, and decreases, we know for the ovary, less follicle development and less blood flow to the ovary. Certainly may affect blood flow to the testicle. The other part of that is you don't want to have secondhand smoke in the house, either for your partner who's trying to get pregnant, and eventually when you have your family, you don't want to have kids exposed to secondhand smoke. We know that smoking is tremendously detrimental to one's health, and getting ready to be pregnant, this gives you the impetus to move that out of one's life. Marijuana, there's some women say, well, my husband, they're creative people and they're all get together in a group and they're smoking a lot. You got to decrease the amount, I think, as much as you can. Small amounts of marijuana or CBD are probably okay. Everything in moderation, but anything you do to decrease the amount of chemicals that come into the body is probably helpful. Steroids, there's all sorts of male supplements out there. It's unclear what they do in terms of sperm production, but I think any synthetic or even natural chemical that, again, is purported to increase your testosterone probably is not going to help your sperm count. And recreational drugs, obviously, chemicals have all been, of all types, have been shown to be detrimental for both egg and for sperm. And again, preparing to become a parent where you have to be very responsible in terms of what you do. All right, so fertility for the future. And today we have the amount of technology we have compared to even 10 or 15 years ago is really amazing. Now we've been freezing sperm for 30, 40 years. Sperm are very small cells. We have millions of cells. If you thaw sperm, even if you lose half of the sperm, you've still got plenty to work with in terms of IVF or insemination. So sperm freezing is an excellent technology. If men have to undergo chemotherapy or other medical treatments, freezing sperm beforehand is an excellent idea. But freezing and thawing sperm does not damage the genetics of the sperm in any way. Same thing for egg freezing. People say, well, if you freeze my eggs, is that going to damage the quality of the genetics? Will I have abnormal babies? Not at all. Freezing either of the egg or the sperm has no issue. And the same thing for embryos. Today with thawing eggs, 90% thaw rate is pretty customary. Thawing embryos, particularly high-grade embryos, day 5, when there are 100 cells, the thaw rate's 95, almost 98%. So that technology has evolved very, very well in the last 7 to 8 years. So people ask about egg freezing, and that again has been very popular. And all young women in their 30s have been having their friends freeze their eggs. Again, egg quality, as Dr. Alexander mentioned, is better under the age 35. And today, so many women and men, in terms of becoming a couple, lost 2 years with COVID. And so women say, well, I used to think I was going to be into a relationship when I was 31, 32, 33, but now I'm 35 and starting all over with the relationship. Freezing the eggs is certainly a very viable way to preserve one's future fertility. And it could be not for baby number 1, but for baby number 2 or 3, when the woman is 40 or 42, when it's very difficult to genetically get embryo. The uterus really does not have any age effect through the mid-40s. But the process is, it starts with beginning of the cycle. We usually start on a birth control pill for about 2 weeks to get the ovary quiet, synchronize the follicles, which contain the egg. And then when the ovary is quiet, you stop the pill, and then you stimulate the ovary for about 12 days. A woman ovulates day 12, 13 of her cycle. You have to have a mature, what you call ripe egg, to be able to retrieve it from the ovary and either freeze it or fertilize it. So this again kind of outlines the 2 weeks of birth control pills, which many women will take, and about 2 weeks of injections. So for the start of the first menstrual period, to move into an IVF or an egg freeze cycle, the egg retrieval is about 4 weeks later. So you can arrange for work issues and so on. But the process, when you're taking the birth control pills, requires no monitoring. Once you start the injections, they monitor with a blood test and an ultrasound on day 4, day 6, day 8, day 10. And These are usually done in the morning before people go off to work, or if you're working from home. We get the results in the afternoon and call you until you go up on the dose or the same, and also helps to predict about where the egg retrieval is going to be. Egg retrieval today is very simple. It takes about 15, maybe 20 minutes with a very light anesthetic called propofol. Same thing we've all had for dental work and other minor procedures. You wake right up afterwards and you're out the door. Most people just take Tylenol after retrieval. It's again all done with ultrasound and a needle that you see on the diagram that goes through the lateral vaginal wall, which is very thin, just like the skin on your arm when you have blood withdrawn. And you look at the ovary in the top panel, you see they talk about a chocolate chip cookie with a lot of chocolate chips. Hopefully there's 8 or 10 follicles in the ovary on each side. And you see after 12 days of stimulation with the injectable follicle stimulator, you have 20 millimeter follicles. And then you know there's a mature egg in each of those follicles. And the maturity is important because you can't freeze an egg or fertilize it unless it has maturity. But again, the maturity is monitored when we do the ultrasound and the blood test. But it's a very safe procedure. And you see on the bottom panel, that little straight line, that's a needle, a very small needle that goes about 3 or 4 inches right into the ovary. You take the fluid, and the fluid then passed into the laboratory. And then the embryologist takes the microscopic egg from that fluid. Just to mention, the stimulation with follicle stimulating hormone has been available for 30 years. Tens of millions of women have done IVF. There's no cancer associated with that, and there's no early menopause. The ovary is recruiting the same group of follicles each month and releases one egg, the others dissolve. And that's how women exhaust their egg supply over time. So you're only bringing to maturity would-be wasted eggs. So there's no early menopause. There's no detrimental effect on one's fertility in the future. So you can see on the slide here what the egg looks like, and it's microscopic. Go to the next slide. This just kind of gives you an idea about how many eggs do you need to be successful if you're going to freeze eggs. And you see that last group of 15 to 20 eggs gives you that pretty 80% chance of success in the future. But again, the red bar is if the woman is in their late 30s, then you need more eggs to give you the same kinds of pregnancy rates. So you're looking for that genetically good egg. And we know that the genetics, the chromosomes, we talk about 23andMe, 23 chromosome pairs. When those pairs have to separate right at ovulation, the chromosomes are sticky. Chromosomes get left behind or duplicated. So when the sperm comes in with its 23 chromosomes, you've got too much genetic material or not enough if the chromosomes are sticky for the egg. We know when we have abnormal embryos, 90-some% of the time, it is from the egg and not from the sperm. The sperm are, again, made every day. They're brand new. I don't know who designed that process, but unfortunately, luckily, the male sperm seem to do very well up to age 45 and beyond. Next slide. So we talked about egg freezing. The other is how do you get pregnant without having to go to IVF? If you're a couple and you've been trying to get pregnant for a while, let's say the sperm count looks good and the woman is ovulating, she's having regular cycles. One of the first treatments is intrauterine insemination. And it's really unclear why this helps, but it certainly does. Again, we do it with timing. We look with ultrasound. You can see the diagram of this large follicle, that dark area. In that leech follicle, we know when a certain size has a mature egg. We actually can give an injection of what they call the LH surge to release the egg the next day. And that's when the man comes in, gives it a specimen, or if we have frozen specimens, they thaw that. And they do a swim up to pick out the very best swimming sperm, and just concentrate it into a few drops into the tip of a little small catheter that goes into the uterus, just like a pap test. It's that simple, but it does enhance pregnancy rates for most couples when all the testing is normal. Or if a man has a slightly low count or the sperm don't swim very well, picking out the very best swimmers is really helpful. So that's the kind of the first low technology treatment for couples to improve fertility. So we talk about this unexplained infertility, which is the woman is ovulating, she's having regular cycles. There's a sperm count that's been done, and the sperm count looks great. There's an X-ray procedure called an HSG that is an X-ray that outlines the uterus and the tubes. And if all those testing is normal, looking at thyroid and some other hormone issues, what's the chance of getting pregnant after a year of trying? It's about 2 to 3% per cycle. So if you add this IUI insemination, it kind of gets it up to the 5 or 6% range. Then we add fertility medication. Clomid plus the IUI can get pregnancy rates up to 8, maybe 10%, depending on the woman's age. And then adding injectable follicle stimulator with insemination can get up close to a 10% range. And that's per cycle. And again, a lot of that has to do with, again, the genetics of the embryo produced. Genetics is such a big part of successful pregnancy. So then you look at in vitro fertilization, that's 60, 70% effective per cycle. But again, with IVF, you're stimulating the ovary to produce probably a year and a half's worth of eggs into 1 month, fertilizing as many as you can. And then you genetically test embryos. Today, we know with the genetically tested embryo, the pregnancy rate is close to 75%. And the miscarriage rate, instead of being 15 or 20%, which it is for all women, for all pregnancies, drops down to about 8%. So that's been the huge improvement in the pregnancy rates and full-term delivery rates with in vitro fertilization, because you can select the genetically balanced embryo. And here it just shows IVF. You can see an egg, it's like jelly. And there's a sperm right in the tip of that glass, and they put that sperm in the egg, does not damage the egg in any way, but it maximizes or optimizes the fertilization. You don't want to look at the eggs the next day and find out that only a few of them have fertilized. So that is traditionally done most of the time. And again, it's very, very safe. Then we watch embryos grow for about 5 days. You can see down at the bottom, there's what they call a blastocyst, which is about 100 cells. So at that point, about half of the embryos that initially fertilized will stop growing by day 5. And again, that's because of the genetics of the embryo. You're talking about 30,000 genetic pieces from the sperm and the same number for the egg. And that reassembly, Mother Nature will get it right maybe half the time to grow these embryos to blastocysts. And then again, depending on the woman's age, if we take a few cells and genetically test the blastocyst, of the woman is 35 or under, we know that about 60% of those tested will be normal. Only 60%, 65%. When the woman is 40, it's 25%. So again, that age factor and the sticky chromosomes is what really comes into play. But today, if we can get a genetically balanced embryo from a woman that's 41, 42, 43, just one embryo, the pregnancy rate is 70%. This is a nice little video of what it's like for an embryo, and this is what happened for all of us when we came to be. The sperm and egg got together, 2 cells, 4 cells, 8 cells, 10 cells. Over a period of 5 days, we get to this, what they call blastocyst. And that's the miracle that allowed all of us to come to be today. But again, we know that if those fertilized, only half of them probably make it to the blastocyst stage. And again, when you test the blastocyst, depending on the woman's age, it could be 60% normal, it could be 20% normal. But they estimate there's never been a clone for any of us since the beginning of time, humanity. So the billions and billions of embryos, that reassembly of 30,000 genes from the sperm and the same number from the egg, everybody is unique. And none of us are perfect, but we made the cut. And that's what we look at. And again, IVF success rates. If you transfer an embryo of, let's say, a woman that's under 35 and you don't do genetic testing, the pregnancy rates are half of what they would be if you genetically test, but also with a lower miscarriage rate. And then you can see in the SCRC bar, it makes it a little bit higher. We achieve that with genetic testing, but also EmbryoScope. An EmbryoScope does essentially time-lapse photography or imaging of the embryo as it grows. We know that embryos that grow asymmetrically, instead of going 2, 4, 8 cells in the first few days, go from 1 cell to 3 cells or 1 cell to 5 cells. They do not have the same potential of those that grow symmetrically. So when you get ready to transfer a genetically tested embryo, you look for the one that develops symmetrically. It has a much higher pregnancy rate. So you take the best embryos first for transfer to the mother. And so we're looking at this 2020 data for Sarton again. We look at that age factor, which I don't want to scare anybody because there are some women in their early 40s that have very good egg reserve. It's just a matter of finding the one that's genetically good. And we do that with fertility medications or IVF. But our laboratory has been extremely successful in achieving really the highest pregnancy rates in the nation. We're grateful for our team, our 7 physicians, and Dr. Barrett, who's our embryologist, isn't on this slide, but again, he's a very gifted individual that's, again, created a laboratory that provides the very best outcome of any IVF program in the world. So here's some of our promotions. And again, because of COVID, we've tried to do everything we can to make egg freezing easier. It's expensive for young women, but there are financing plans. Get a friend and egg freezing, it takes the pressure off of one's fertility. Like I say, COVID has sort of delayed a lot for many women, couples today. And egg freeze or embryo freeze really keeps the door open for years and years to come.
Thanks, Dr. Danzer. I was reading through some of the questions and I had a interesting, I love the way you explained how many eggs. I think what's so interesting when we are talking about egg freezing is the magic that the ovary each month has sort of a pool of eggs, and nature tries to ovulate 1 egg, but the group of follicles, which can range from a few up to into the 20s, that group of follicles has the potential to grow with the medications that have been around since 1962 called follicle stimulating hormone. And so a patient asked, how many eggs do I need? We've had patients have a few eggs and get good embryos when they go to thaw. My own college classmate had a lot of eggs, but her partner had very, very challenging sperm. And so it was harder to get a good embryo. So it did take a lot of more eggs than expected. But on average, we're trying to get 10 to 20 frozen so that you have a chance for the future. Dr. Barrett has done an analysis at 37 years old. We need 17 or more eggs to get a chance for a pregnancy. And so it's sort of a backup plan Typically, some of our patients try naturally, and then if they get pregnant, they'll use their eggs for kid number 2 if needed. And so each person's journey is their own individual experience. And so we do the best we can to get quality and quantity eggs from each try that we're going to try. And a lot about responsiveness of the ovary to the medications has a lot to do with what Dr. Danzer mentioned, which is blood flow to the ovaries and improving, avoiding toxins, improving your exercise regime and things like that. And that'll help us get a better outcome for you, because we use a specific medication protocol to your body and your situation. If you have PCOS, endometriosis, things like that, we take it into consideration.
And how an individual's response to the stimulation, whether it's Clomid or one of the oral agents or injectable FSH, tells you probably the very best test of one's egg reserve of fertility now and in the future. So the stimulation gives you tremendous information.
And one patient asked Dr. Danzer, what if I've been on the pill for a long time? What do you think of that?
Yeah, the birth control pill basically preserves one fertility, does not in any way have a negative impact. I think to get a good idea about one's egg reserve, you have to probably go off the pill for a month or 2 as a washout to get the best estimate for the basal follicle count, which is the ultrasound, which you do on day 2 or 3 of the cycle when you've recruited that group of eggs. But yeah, long-term birth control pills can suppress AMHs also. They're not supposed to, but long-term can, and certainly can suppress your basal follicle count. So washout's important.
And I think the pill is such an interesting thing, because with hidden endometriosis, young girls that have really painful periods that go on the pill, they're probably protecting themselves from inflammatory cytokines that happen every month when we ovulate. And so if they've been on birth control pill and suppressing ovulation, that can have help us with really high testosterone, especially when we get the hair here with PCOS. The beauty of the birth control pills is it soaks up that high testosterone by ramping up SHBG, and then that will lower the environment of high androgens at the egg. And so there are some patients that really benefit from being on the pill. There are times where if it's been such a long time, like 15 years on the pill, it's better to take a breather from the pill for a month or so before we start the process. But each case by case has different situations. There's a question, Dr. Danzer, for you is, what's the oldest client we take?
I'm sorry, what's the oldest?
The oldest patients will help.
Yeah, I just had 2 patients this year that were 44 years old. Again, one had to do 3, and I think the other had to do 4 IVFs to find that golden egg, or the one egg that gave the one embryo that was genetically balanced. And both of them are in their 2nd trimesters now.
And I know you've helped women in their 50s with donor eggs. So if she froze her eggs in her 30s, we can use those eggs up to age 53. Or we've had women come in who are really exercising fit, their mammograms up to date, and they're in their early 50s, and we can get eggs of someone who looks like them, and that's called donor eggs. And they carry the pregnancy with the sperm of their partner or with donor sperm if needed. And so it's a fine tuning the situation to your specific case. We also have had, and I know Dr. Danzer's helped people I know in their 50s who wanted to use a surrogate. And so, and the man was older than in his 50s. And in those situations, we help you navigate getting someone who's less than 35 years old, the surrogates, to carry the pregnancy. So we don't have a specific like age cutoff here. We just cater to your situation and talk out the pros and cons for your case.
And like I say, luckily, the uterus doesn't have a lot of age effect. It's brand new every month when the woman has a period and the lining rebuilds, and it stays receptive up till the very late 40s, early 50s.
So Dr. Danzer, this one says, I did a hormone test and the results showed high testosterone. What can I do to elevate my levels. But I think if you want, I can try to answer that one. But
Yeah,
basically,
that's your
when
specialty.
when it's a high testosterone, we try to improve that because that affects the egg quality in a sense. Sometimes there's a medicine called metformin that can improve insulin resistance. Insulin binds to the IGF-1 receptor that causes the theca cells to make testosterone. So it's kind of a roundabout way. Lowering the way carbs and exercising also improves the functionality of your ovaries and helps us lower testosterone. And in some IVF protocols, we'll use the birth control pill for a few weeks or even longer to suppress testosterone. So when we grow the eggs, we're in a better micro environment around the eggs. I hope that answers your question in that specific question. There's Dr. Danzer for you. If the patient's overweight and she's 32, can she still freeze her eggs?
You can. Obviously, we like to have a BMI under 30. There's some mild risks when you're too overweight as far as the anesthesia or a response to the medication. And again, that can be individualized in terms of one's work with them nutritionally and with acupuncture and exercise program. Losing 5 pounds, 10 pounds can have tremendous advantages to one's physiology, and so one is more receptive to the treatment. So we work with everybody in terms of what's individually optimal for them.
Any other questions? Thank you so much for this opportunity. I wish you all the best on your journey. And I love working with you, Dr. Danzer. Thank you for always being such a wonderful teammate.
Thank you, and you too. And we're very happy to work with any of the people on the podcast today to have questions or would be very happy to be part of your care.